my goodness, it's been a long time.
Right?
Well, what, about 30 years ago? UNC, when I was in the CTICU, they had programs where high school students would come and look to see, trying to choose a career path. So I would tell them why they should be a nurse and show them all the fun and exciting things I get to do in the critical care unit. Candice was one of those students.
Yep. I was 15 and I was at Nursing Exploration Week. We went to Chapel Hill for a week and went to all the surrounding hospitals. And one day I came and observed Renee. I always knew I wanted to do something in the medical field. I started to explore nursing more, and that's really what I wanted, was to be with people during their toughest course, during the trying times, and help them get on the other side of it, whether it be better, different, whatever it is. I just like to help people through that.
I think my biggest influence was my mom. She always wanted to be a nurse. I always talked about being a nurse. I honestly thought I picked nursing because I love caring for people. I think the most wonderful profession because you can do so many things with it.
Mentorship is so important. It's so hard when you're new. You learn a lot in school, but you learn so much more on the units, on the floors. And it's so important to pass along that knowledge. And it's hard also to be the mentor. It's hard to be a primary preceptor, to always have a new nurse with you, but also need to ground yourself and remember why you're the one passing on that knowledge. Just be patient. Remember that you are helping your industry. You're helping the patients ultimately, because if you help train these nurses, all of our patients are going to get better care.
That's extremely important. And I'm glad that we have more mentors now. That was something that, again, back when I started, you really didn't have. A lot of times it was sink or swim. So I think it is wonderful now that hospital organizations have recognized, hey, it's not a sink or swim. The nurses coming out still need guidance. They still need someone that can help them find their way and help advise them as they're developing their careers.
My mother is moving to Raleigh to be a little closer to family, and had a box full of mementos. And in there I found multiple copies of a local newspaper, and it had this article. And so out of all of the mementos, I was like, well, this is pretty interesting, because I had just hit 20 years with UNC Health. And so I looked Renee up, but her name was spelled wrong in the newspaper clipping. And so I didn't find her, so I let it sit for a couple weeks. And then I tried again, a couple different variations, found her, emailed her, and I said, hey, you got a minute? Does this look like you? And so we chatted on the phone, and it was just so funny to think that I've been here for 20 years. She's been here for 30 years, and we're in the same patient care field. We're both in surgical services.
You are a caregiver, but you need to take care of yourself as well. We tend to give our all to our patients, and sometimes you have to remember you've got to take time for yourself so that you don't burn out.
Plan for yourself. Where do you want to go? Prioritize yourself and your goals. I know Renee and I have both gone back to school, and I think that it's important for you to prioritize yourself and know where you want to go with your career.
It's nice too that UNC now has the Develop Me programs to help, lead and get nurses to where they want to be. And that's the beauty of nursing. There's just not one facet.
Just know that what you're doing, what you're saying to the next generation could be changing their lives.